Artificial Intelligence Dr. www.abcpharma.net/English. User question: can the lack of atrial pacing after an unicameral leadless pacemaker implantation cause an extensive list of symptoms in a patient with a non-fever virus infection, rhinoviruses? Claude A. Answer: the lack of atrial pacing after a unicameral leadless pacemaker implantation in a patient with a non-fever virus infection, such as rhinoviruses, may potentially contribute to an extensive list of symptoms. However, it is essential to note that the relationship between these factors is complex and not well established. Here are some points to consider. 1. Unicameral leadless pacemakers. These devices are typically implanted in the right ventricle and provide only ventricular pacing. They do not have the capability to sense or pace the atria, which can lead to a condition called atrioventricular (AV) dysynchrony. 2. AV dysynchrony. In the absence of atrial pacing, the atria and ventricles may contract independently, leading to suboptimal cardiac performance. This can result in symptoms such as fatigue, shortness of breath, and reduced exercise tolerance. 3. Interaction with viral infections. Rhinoviruses, which cause the common cold, can affect the respiratory system and lead to symptoms such as cough, sore throat, and body aches. In some cases, viral infections may also have systemic effects and exacerbate pre-existing conditions. 4. Potential symptom exacerbation. In a patient with a unicameral leadless pacemaker and AV dysynchrony, the added burden of a viral infection may worsen their symptoms. The combination of suboptimal cardiac function and the systemic effects of the viral illness may lead to an extensive list of symptoms, such as extreme fatigue, pain, and respiratory discomfort. 5. Individual variability. The extent to which the lack of atrial pacing and a viral infection contribute to a patient's symptoms may vary depending on their underlying cardiac condition, overall health status, and individual immune response. It is crucial for healthcare providers to carefully evaluate patients with unicameral leadless pacemakers who present with an extensive list of symptoms in the context of a viral infection. A thorough assessment of their cardiac function, pacemaker settings, and the impact of the viral illness on their overall health is necessary to develop an appropriate management plan. In some cases, upgrading to a dual-chamber pacemaker system may be considered to restore AV synchrony and potentially alleviate symptoms.